So who you'll be hearing from today, you'll be hearing from my good friend and colleague Shane. You'll be hearing from Michelle in far-flung fields west of London. You'll be hearing from Jonty, I think just about as far again east of here. And you'll also have the bad fortune of hearing little from me as well. Right. Definition for today. So what are we talking about when we're talking about systems leadership? So yes, there are lots of definitions you can find. This is the one that we think is a really good one and we'll be using today. So systems leadership is about how you lead across boundaries, describing the way people need to behave when they face large, complex, difficult, and seemingly intractable problems, where they need to juggle multiple uncertainties, where no one person or organisation can find or organise the solution on their own, where everyone is grappling with how to make resources meet demand, which is outstripping them, and where the way forward therefore lies in involving as many people's energies, ideas, talents and expertise as possible. We were very keen to include that last bit in particular, as that is sort of a version of what we are doing today, involving as many people's energies, ideas, talents and expertise as possible to help us all grow, whatever context we are working on in terms of system leadership. Systems leadership, how you lead across boundaries, is the key here. Thank you very much, Better Care Fund Support Team 2019, for helping us with that definition. We are a large group. We're not going to do an extensive check-in, but we are just going to use Menti, if that is okay. So we are going to do a brief intro setting just through Menti. So you can scan the QR code on your screen. You can go over to menti.com and hit 2801-5164, or you can follow the link in the chat. Ooh, let's go back a bit. But menti.com, 2801-5164, please. First question, they get slightly hard on this, but first question, please. Which healthcare system are you part of? Or we do want a bit more than just a whole load of UK blobs, or have worked in. So if you work in the UK but have previously been part of a far-flung healthcare system, you might want to go for that one just to give us a slightly more variety. But which healthcare system are you part of or have worked in? We might have a large number over the UK. Good, we've been able to differentiate at least between parts of the UK. Excellent, look at this. Lovely stuff. Thank you very much indeed. Great stuff. We'll leave this just to run for a second. Excellent. It's at this point when normally when we have a UK map, I sort of make some remark about how lovely it would be to have more people from Cornwall. But I can't see that on this map. So if you are from Cornwall, just put it in the chat and we'd be delighted to have you with us. Great stuff. Thank you. I'm not going to challenge my poor sense of geography by trying to say exactly what all of these dots are, other than it seems like they're either islands or just generally in the sea for a few people, which maybe is an aspect which we're going to come on to. Thank you very much indeed. So next one. So from your perspective, and this is your perspective, and you might say, well, I'm still trying to work this out, but from your perspective, what is the most challenging thing about system leadership? Again, that definition we're using, system leadership, is about how you lead across boundaries. What, from your perspective, is the most challenging thing about systems leadership? We talk quite a lot at Glasgow about grounded hope. There is always the need for hope. There's always the need to believe that things will be better tomorrow than they are today, but it needs to be grounded. It needs to be rooted in the lived reality and the challenges of the systems in which we work, of which there are indeed many, and popping up on the screen. Lack of funding, resources, relationships, complexity, how to bring all partners with you, tinkering rather than being radical, encouraging others to join in the journey as active participants. Lovely, thank you very much indeed. Siloed professions, siloed trainings, lack of connection and no solid foundation of trust. I can feel coming through the screen the ability of people to get things off their chest. Lovely, thank you. Trusted relationships, challenging power relations, translating between different cultures and jargons. Great, thank you very much indeed for this torrent of challenge. I've been promised by our speakers today that they have the magic potion which will solve all of these and take them away at a single stroke. Maybe or maybe not. We'll allow Michelle. Michelle's shaking her head. Okay, Great, thank you. We can see the level of challenge we are working with. Yeah. Next one. Let's go slightly sunnier. So we've covered off challenges. If you were to think about the best systems leadership you've experienced, which there's no place for humility here. If that is your own, fantastic. Please do share. But that might be of a colleague or of someone else you've seen in another organisation. But thinking about that best systems, that best bit of systems leadership you've experienced, what made it so great? Why is it that which has jumped to mind at this point? We've even given you some bluish sky and some pinkish clouds to sort of aid your inspiration. But just thinking about that best systems leadership you've experienced, what made it successful? Thank you. Generosity, trust, humility, lovely. Reciprocity, thank you very much indeed. Genuine relationships. This is the part where words start to fly in. So you may want to look to one side so they all come by. Lovely stuff, thank you. Trust, continue to sit there in the middle. Lived experience, really important. Thank you. I'm hoping again for you to get onto that as we go through. Soft skills, or are they soft at all? Maybe again something we can talk about as we go on. Thank you very much, everyone. We'll give you just a moment longer. System focus again. Clearly defined asks. Great stuff. Thank you very much indeed. We'll be giving our take on this question as Kaleidoscope in just a moment. Thank you. Right, we're going to move on just before these words sort of dazzle us too much. Last question, please, and then we're going to get into it. You can think about lots of different aspects of system leadership. If you were going to pick just of these five, which are you most interested in? Which would it be? So aspects of system leadership: building trust across boundaries, enabling and driving purposeful collaboration, embracing difference and challenge, skilled partnering with those we work with and serve, or catalyzing and embedding innovation. Which of these would you pick? Thank you very much, everyone, as this comes through. It is very hard not to commentate on this a bit like a horse race, so I'm not going to do so. But fantastically even spread. Thank you. We will pause it there. But wow, okay, right, we had no idea which way this was going to go. Other than we thought, well, if there's a clear area of focus, that will help us out later when we're directing questions. But the fact that actually all of these are pretty much even, as close as we could get to even really, is rather striking. Great stuff. Okay, thank you, everyone. We're going to pop back. And what we're going to do is we're going to pass over to Shane. Hello, Shane.
Hello, Rich. Hi, everybody. Let's see, so many familiar faces and new faces. I'm Chian, part of the team at Kaleidoscope. I have the great privilege of leading our OD and leadership practice here at Kaleidoscope. And my job today is just to provide a very brief a little bit of context setting and a little bit of provocation through the lens of some of the things that we're seeing turning up on a domestic front. It's also my job to make Michelle and Jonty look even better than they already are. So you can put down any deliberate shortcomings to that in the service of them. Just a little bit to say, why have I got anything to say about this for Kaleidoscope? Well, apart from my professional practice, I'm really lucky to teach this at UCL to healthcare professionals. I'm also a proud trustee of a mental health care provider in Southeast London who provide a human and social approach to dealing with issues related to long-term mental health, very much through a systems lens. I grew up in Northern Ireland and got shipped off to the US after university to take part in a program on systemic change around some of the intractable and still intractable problems in Northern Ireland. I'm also deeply in love with a social worker, an international social worker who often beats me over the head with books like the systems work of social change, or systems thinking for social change, coming at to a bookstore near you. But actually, the thing that really piqued my curiosity in systems leadership was being part of a family. I'm not sure if anybody else here is part of a family, but it's very interesting to observe a family. I think it's maybe the ultimate system. And I don't know if maybe it's just my family, but if you've observed how the interactions, intended and otherwise, often generate unintended and mostly, in my experience, unwanted outcomes. And I think that's quite fascinating, just to start with that idea of a system not being a machine, but something that we're really familiar with, being a family. So if it can't change the world, or even health and care, this might change your family. So let's get into it. Rich, thank you very much. So all of that, living, teaching, loving, what has it led me and us to believe? Well, I guess 4 lessons, I think, around systems and systems leadership. All systems are non-Newtonian, as much as we want them to be. A to B does not bear reality to what happens when we get out of bed in the morning or step out of the door, whatever it happens to be. All systems, our relationships with each other, are complex and dynamic. They are relational. I am because you are. We are because this is because that was and will be. And the second thing is that because health and care, particularly as a human system, it is deeply fallible. Things will go wrong. That is just the nature of it. The third thing is all human systems strive towards homeostasis. That's what keeps us alive. Systems are hard to change. Now, that's all 3 reasons for hopelessness, or it's 3 reasons to sort of liberate ourselves from the tyranny of the idea that if we just lead harder or work harder, things will be better. Donella Matthews, one of my great heroes, sums it up very nicely there on the right. And our persistent, intractable problems, including in healthcare, directly arise from our unwillingness or inability, or the unwillingness of others to allow us to accept that those things are true. And that's frustrating for us, and it's frustrating for the people around us. And there is a false generosity in pretending anything otherwise. So we also know that determinants of health are largely not health related. So education, transport, access to healthy food, employment, housing. And anybody who has watched the Live to 100 Blue Zones will understand exactly that where people are living longer and healthier, it's because of systems leadership that's largely not organized around health. I really, really commend this to you. Anyone who's in the UK working in an integrated care system, I suggest every integrated care system should have one task, which is to turn their community and their population into a blue zone, very simply. So what system leadership is, good system leadership is about, Rich, thank you. So we think that there are 3 elements of system leadership that works. The first element is the problem at hand. So deep knowing, we'll talk about what that means. The second is the task of system leadership. The primary task of system leadership, we think, is to enable collaboration. And then the style is collective. We wrestled with lots of adjectives there, but we'll come back to that. So we think there are 3 elements at play in good systems leadership. Thank you, Rich. So a quick look at each of those. So deep knowing of the problem. So the question we would invite systems leadership to ask is, who is at my table? Because deep knowing of the problem can only come from deep knowing from the people who are part of the system, part of the community that experiences and understands that problem. Understanding a system is just abstract. It's largely pointless. The game is understanding the problem, and then taking a systematic lens on why it exists and why it persists. Kaleidoscope exists to bring people together to improve health and care. We believe that bringing people together is a way to find new solutions to old problems. So our approach to deep knowing is entirely social, and we believe that this is the only way through. I mean, this can be applied at a number of levels. So On the top left there is an inhaler. So my mother died when she was 37 from asthma. So we've been slightly obsessed about the systemic issues around that. And we convened a group of people not long after I joined Kaleidoscope in a part of England where they were seeing disproportionate pockets of respiratory disease among children. Bringing people together, including for the first time, people who were providing local housing, transpired that actually the issue was largely associated with the quality of housing in a particular postcode and actually very little to do with anything else. The second way that we're applying this is at a more sort of systemic issue. So on the left, and apologies for those of you outside the UK, that is essentially what an integrated care system looks like. Now, that is a simplification of what an integrated care system looks like. But even that is on one level helpful, but it's not particularly useful because the problem integrated care systems are feeling is nothing's changing. So just understanding those blobs doesn't make really a difference. So taking a collective lens, what we're proposing, what we seem to be finding with our clients is actually the problem is that we need to make these 7 shifts from left to right. And suddenly knowing that and having an understanding of actually the problem, not the system, opens up a whole new set of possibilities to attend to those 7 shifts in a deliberate way. So again, through a collective lens, less about the system, more about the problem, but bringing the system to bear on the diagnosis and the response. Okay, Rich, thank you. So that's the problem in deep knowing. So who's at my table? The second question, the task is to enable collaboration. So the question for system leadership is, am I being deliberate? We're obsessed about the science and the art of collaboration. And what we're really encouraged to see is that people are now moving beyond a conversation about, well, if we just rub along, if we just get along better, if we just try a little bit harder together, if we just do these things, but ought implies can. And actually, our research shows there are 8 characteristics of really effective collaborations organized in 3 pots. 1, there's a clear shared purpose to which partners are committed and organized around. There's a focus on building the right culture, and there are resources and structure to concede. And so the good news for system leader, a bit like deep knowing of the problem, is these things are malleable. They are available to you. You can put these in place and you can work with them. And you can actually start to diagnose a little bit about where you are as a system leader, how your system and how your collaboration is stacking up, how it's healthy, whether it's healthy, where it's not, where you might want to invest a little bit more, where you might want to double down. And that's work that we're really encouraged to see more and more of our clients asking us to do to support them on. So that's the task, enable collaboration, question, am I being deliberate? And then the third element of system leadership that works from our perspective is the style, or maybe the spirit of leadership. And the question here is, am I building the right capabilities? So we've talked a little bit about the anatomy of systems leadership. This is the sort of physiology, I guess. And what we're seeing is essentially, as Donella Meadow says, it's a different kind of leadership. It's a leadership that is distributed, not hierarchical. It's unboundaried. It requires a sort of an expansion of our caring and our curiosity. It's without authority. It's relationship based. It tends to be long term. It's about bringing the idea of collective abundance in the face of boundaried scarcity. It's about transforming things rather than practice, transforming people and principles rather than things. And again, what we're really encouraged to see is more and more of our clients and systems being quite deliberate about understanding that. Rather than saying to their people, you ought to collaborate more, they're asking, what are the characteristics we need to support you to help you do this? So this is a piece of work that Jonty will be familiar with, that we supported our client in Southeast London with over 6 months to define with their system, with their communities, what are the characteristics of a Southeast London leader that will allow us to achieve what it is we're trying to achieve, and then investing in that. So through the Southeast London Leadership Academy, which you can find out about with a quick Google, investing in community around these characteristics and skills development around these characteristics, and then with a very specific investment in the science and art of innovation. And again, what we're seeing is the ability to just diagnose and ask those we are asking to lead in a systems way to tell us what is the support they need in each of these characteristics. Thank you, Rich.
Fine, thank you very much indeed. So we've given you just some of those boundaried foundations in terms of systems leadership that works. This is the kaleidoscope, the Greenwich School of Thought, so to speak. But we're going to go on and hear from Michelle in Alaska and Jonty in Singapore. Are we barking up the right tree, the wrong tree? Are we in a let's not mix metaphors too much? Are we not seeing wood for trees? We could go on, couldn't we? But what we're really interested in seeing is how do these concepts sort of look from different perspectives. So we're going to start with Michelle, then come to Jonty in terms of hearing their journey of systems leadership, power and challenges of leadership in their context, and how we enable that promise. I'll allow Michelle and then Jonty to introduce yourself. But Michelle, we have to say thank you so much for getting up so bright and early to be with us this morning. Michelle, hello.
Yes, good morning, good afternoon, good evening to everybody. So I'm going to try to talk my East Coast fastness and then see how much I can get out and vomit on you in just a few minutes. So I'm really appreciative of being here and being in the conversation. I'll just start this, the me part of this. If I think about how I've come to system leadership, well, maybe I should do this first. So I work in Alaska. I am living in Alaska for many, many years now. I work in a system that is owned by the community. It's an Alaska Native, customer-owned, community-driven system. It's a system which serves about 120,000 people across a geographic. We always we joke in Alaska, if we cut Alaska in half, Texas would be the third largest state. So the geographic span of the state is huge. Most places you can only get to by plane or small boat. My husband right now has been stuck on an island in the middle of the Bering Sea for 2 weeks because he's a physician and he can't get off the island. So he is physically stuck there, and he will be stuck there until the system can get him out. Anyway, originally from the East Coast. So, and we are a primary care service, but we're also a hospital. We provide mental health. We provide social care. We provide all of the things. It is a relationship-based, customer-owned system. I can talk about that for hours. So that's who I am in the context. So how did I get to system leadership? I would love to tell you that I was intentional and smart and capable and said, this is how I want to be. But the reality is this approach to thinking and being aligns with who I am from a personal perspective. It's how I came into being Michelle. And I think that's an important part of how we at my organization think about people who work and give their lives to this work, whether it is the community that we're serving or it's the people who work in the system. So I come from a background of trauma and abuse, and I come to this work as a strong, confident woman working in the system. And part of what we do and part of what I bring is my personal story affects my perspective, which impacts the people I work with, the people I lead, and the people I serve. And to understand how to lead in a system, I have to understand myself. So we do a lot of work in our organization around self-awareness and what people bring to it. And we don't train anything that we don't build systems and structures for people to support. So that's the me. The we is that we are an organization that is driven by the community. So when I saw the slide that says at my table, the word my table, I would challenge to say who's at our table, because collaboration is about bringing the expertise of the system, right? Whichever system you're talking about. But all the systems to that table. And so we have been on a 35-year journey of trying to figure out where all those boundaries are and how we break them down. And I think fundamentally, for us, it boils down to control. We all want it. We all have this imagining that we own it and that it's ours and that we know. And until we respect and honor the people, other people's stories and other people's perspective, and let them bring that wisdom to the table and help co-create, that we're losing. And we've been mildly successful at being able to break down those boundaries and create an atmosphere of we, but we're not there yet, because while we speak, even in our organization, of breaking down boundaries and breaking down hierarchy, we still have it. It's what we all grew up in. It's what we all know. You know, if you listen to Peter Senge or Chris Ardress, it's just there. It's the background. And to break it down, we all default to it. So we just have to keep reminding ourselves we're on a journey together, and we're going to screw it up, but we're also going to kind of keep getting it right. And then if I think about the system enabling it, it's everything that we do. And I love that you said it can feel overwhelming, because when you think systems and you think systems leadership, it does feel kind of overwhelming. And it's, you know, that constant thing in your head, which is, who can I blame? Because it's not my fault. I'm doing my part. And that idea of, you know, stopping for a minute and thinking about what am I contributing? Again, that self-awareness is what we think in the future is going to continue to help us as we build an organization that's now generationally seeing the leaders of our organization having grown up in this kind of generative, more systems leadership approach, customer-owned approach, relationship-based approach, being able to lead in that system. It feels more normal to them, as opposed to most of us who grew up in a traditional hierarchical system where do your part and the other part will do their part, and then somehow or another all the magic will happen. And so that's our hope for the future, and that's what we're continuing to build towards, so that we build structures and systems that don't become rigid and hierarchical, but actually become fluid and organic in being able to generate the next future system. So I tried to do that in 7 minutes. I'm sure there's lots of people scratching their heads wondering what I just said, but I'm willing to dive into the conversations in a few minutes. And the last thing I'll end with is that I think my job as a leader, whatever that means, big L or small l, is to create safety in the organization. And some of those words around building trust, collaboration, relationship, none of those can happen without safety. So our biggest job in the organization and in our systems is to create safety so that people can bring their full self and all their ideas and wonderfulness. And we can rebuild the trust and safety we've lost with the communities we've served, because we've done a crap job at it. So with that, I'll stop.
Michelle, thank you very much indeed. Whichever time zone you're in, I'll just encourage you just to show your appreciation. Michelle, thank you very much. What a fantastic sort of provocation, and so lovely to hear about your journey. We'll have time to get into questions and reflections in just a moment, but please do use the chat to start doing that. We are going to come swiftly on to our next speaker. Where, let's just bring that up. There we go. We're going to come to Jonty. We're going to go from morning to night. Good evening, Jonty. I'll allow you to introduce yourself, and away you go. Jonty.
Oh, thanks, Rich, and thank you for inviting me to join from Singapore. So it's interesting. It was very touching to listen to Michelle and her story. I definitely don't profess to bring any magic bullet, but I do hope that perhaps at the very least I can help to stimulate a bit of a conversation this evening. And I have tried to do as I'm told, although, as you know, I'm not always brilliant at it. So I thought I would just talk a little bit about my leadership journey and try to weave in some of the learning that there's been from my point of view in relation to system leadership. But I did want to just, I think right at the outset, share a little bit of a caveat. That is that I've been in Singapore for all of about 5.5 minutes. So I think for me to try to convey anything in any great depth about the particular context here will be quite challenging. I will share a little of my observations so far, but I will also draw on some of the work that I was doing in Southeast London. So I will share a little bit of that as well. I think because that inevitably has formed a part of my journey. And interestingly, so thank you, Shane, so much for sharing some of that Southeast London work. I was actually speaking to the third cohort of our System Leadership Academy in Southeast London just last week. and I was trying to decide where my leadership journey began, and I decided that it was just before my second birthday. Now, before you despair, I'm not about to take you through my entire life history, but I was really pleased that you started by talking about family, Shane. And Michelle, you shared so personally, because one of the things that changed for me just before my second birthday was I became a big brother. And I've been reflecting a lot on the journey that I've been on. And one of the things that really has only dawned on me, I think, quite recently, partly because of some of the teaching I've heard from people like Becky Margiotta, Jonathan Gray, I know is on this evening, is that an awful lot of our work as a leader needs to be on ourselves. And I know that probably sounds deeply obvious to everyone, but it's actually only relatively recently become very, very apparent to me how important that is. So whether it is the bossy big brother, whether it's the bullying I experienced at school, whether it's the shame about being gay, all of those things have contributed to who I am and where I am now. And I guess it feels important to recognize that plus an awful lot of privilege, I have to say, in my life, led me on a journey to become a doctor, to study medicine. And I think that that is probably where I began to develop some of those system leadership skills. So I think there's something for me when I was reflecting on those characteristics and attributes that you were describing, Shane, that really resonate in relation to my clinical practice and my work as a GP. So much of my time I spent dealing with uncertainty, often trying to see the big picture with patients, trying to balance different priorities. Recognizing very much that any change that was going to come about was definitely not down to me, but it was going to be built through relationships of trust, and that also very often rewards weren't going to be terribly immediate. They were going to take time. And those were all aspects of my clinical practice that, as I was reflecting on system leadership, I think stood me in good stead, although I wouldn't necessarily have recognized it at the time, for the leadership journey that I then embarked on when the NHS undertook a reorganisation. It's something that the NHS does relatively often. Many of you will be aware. We do reorganising, and in 2012 we did quite a big reorganisation, and at that point I took on a leadership role as part of what was called a clinical commissioning group, a CCG, and I was sort of catapulted into a leadership role. I was very lucky because there was significant investment at that time in my development. I think because it was such a significant change, it was recognised that clinicians like me who perhaps were less experienced in some of those roles would benefit from developing our kind of capabilities. And it's one of the reasons I've been so passionate about continuing to provide some of that capability and development work for young and emerging leaders through the South East London Leadership Academy in partnership with Dragon's Heart Institute and with colleagues in Kaleidoscope, because I think it's just so important that we recognise that actually that developmental offer is key. I think having sort of been catapulted into that role, it became quite apparent quite quickly that a lot of the way in which perhaps we thought we were going to leverage change through contracting. There was a list that you put up, which I thought was very apt, Shane. Through contracting and reporting and planning and all these sorts of processes, it was very clear to me that really that was not going to result in the kind of changes that were necessary to reflect the complexity of some of the challenges that my patients as a GP and the population were facing. Often their experience was a very fragmented care driven by institutional needs and requirements rather than their needs and requirements. And very often it didn't start to touch on some of those social drivers that you mentioned earlier, Shane. And I think definitely meant that we delivered care in a way that sort of disproportionately disadvantaged certain parts of our community. And that was something that was not going to be addressed through the levers that we were trying to use as commissioners, as payers in the system at that particular time. Now, maybe that was kind of unique to the system dynamics that I was working in at that particular time, but I think it has become increasingly obvious that simple theories of change, linear processes that may be applicable within more hierarchical organizations just don't seem to apply in the complexity of the systems that we're facing. They definitely don't address the population needs that we know we need to start looking at. And of course, we've seen that the way in which we've been working up until now has become entirely unaffordable. Now, one of the things, I guess, then in moving to Singapore is that there are undoubtedly more resources and actually a better life expectancy. So you mentioned blue zones, Shane. Singapore is a blue zone. So we've recently been recognised as being a blue zone, and that means that we have an increasingly aging population. So that comes with its own challenges, and actually the mantra here in National Healthcare Group, where I work, is having added years to life, how do we now add life to years? And it's really important, because that's the challenge that Singapore is going through at the moment, is really to think about how we address some of the ill health that inevitably comes with aging, and some of the costs and so on associated with that. And that actually means that we have some common challenges, but equally that some of the ways that we need to work reflect some of those attributes that you described. So I love that you put collaboration at the heart of this, working across organisational boundaries, innovation, inclusivity, working in partnership with our residents. These are all things I would recognise as being very much part of the day-to-day conversations that I'm having here in Singapore as well. But perhaps the final thing that I would say is that I think it's quite easy to sort of focus on individual characteristics and attributes of leadership. One of the things that's been increasingly apparent to me is that this is not just about mindset, it's also about method. And actually, I am having to learn new ways of working, and I'm having to think about how change happens in a very different way. Not because I'm working in Singapore, but actually, broadly speaking, because I'm trying to think about change within the context of a system. And I think one of the things that is definitely clear to me is that that has to happen in that more distributed or decentralized way. And some of those linear, simple models of change that perhaps are applicable in an organization really don't work in a system context. Now, I say that, and that's as someone who quite likes to be in control of things. So a lot of that is involving significant unlearning on my behalf. But I do say it with two caveats, I think. So I absolutely would be an advocate for that more decentralized working, but I think there are two caveats. So one is that not everything is complex. So it's really important to recognise, and Don Berwick drew attention to this in one of the teaching sessions we had recently, is that within that complexity, there are simple problems. And actually, it's one of the things we've been grappling with in general practice, for example, is what things might be amenable to standardization. What are those things that actually there might be simple solutions for? Meanwhile, we can then focus a lot more of our resources on those much more complex and thorny issues that need our resources. And I don't think we're always very good at differentiating and being discerning about our method. What is the right approach to the particular problem that we are facing? And maybe the second caveat, just before I finish up, is so not everything is complex. The second caveat is that actually there is still a role for the centre. So although I've talked about a much more decentralised approach, and I've been increasingly learning, for example, about social movements, about how we mobilise and organise our communities and enable them to bring about change in a very localised way. There is a really important role for the centre in doing that. And I guess you've shared one definition earlier. The one that I'm particularly drawn to at the moment is one that Harry Hahn shared, which is a Marshall Ganz definition, which is that actually leadership is about taking responsibility for enabling others to achieve shared purpose in the face of uncertainty. And the reason I love that is because it really speaks, I think, to the role that we still have where I am at the moment, which is much more in a kind of, I suppose, in a central organisation within a larger system, which is that our role is very much as enabler, creating some of those conditions. And one of the things that we've been doing recently through the Health and Social Change Academy that I lead in Singapore is to think about how we build our social prescribing capabilities for colleagues across the National Healthcare Group. And we're very much trying to focus not just on creating people who can signpost, but really trying to create the community connectors and the activists who can help us to start to mobilize our communities in a very different way. So I'm really trying to think about how we build those sorts of capabilities going forward. And so I think capability building, creating the conditions, that feels like it's still very, very relevant. So there is definitely still a role for the centre from my point of view, but we have to look at these more distributed and decentralised models of change. I hope that is helpful and perhaps it will trigger some discussion.
Jonty, thank you very much indeed. Again, we will show our appreciation. Jonty, thank you again for joining at the end of the day, possibly turning down the opportunity to go out and have a nice dinner and enjoy your evening instead to come to a webinar with all of us. So thank you very much indeed. We're going to come to a question. So we've got a bit of time to hear more from Shane, Michelle and Jonty. So question in the chat, please. In the chat, so reflecting on what you've heard from Shane, Michelle and Jonty, what got you nodding or shaking your head most vigorously and why? So reflection on what you've heard, what really resonated with you, whether that was in sort of loud agreement or in opposition. We absolutely take challenge as well. Thank you for those already sort of bubbling away in the chat. Whilst that's going to come through, Michelle, I might pick up just on one point, if it's okay, which was just what you were saying about owning up to how badly you, but also I think a lot of us, have done the community engagement side of this and that relationship with population at a deep level, as Shane was saying, rather than the superficial. Can you talk to us a little bit about what you've done in NUKA, particularly to try and rebuild that trust?
Yeah, I think a lot of times the what we do is not particularly earth-shattering. It's the how we do it and the amount of time we spend doing it. So we do a lot of conversation, discussion. We have advisory groups. We do those. We have surveys. We do those regular things. But the most important thing is the dialogue and the conversation. So it's the asking and the conversation, and then it's the what do we do with it? Did we do anything? Does anybody hear back? Is there? It's like, it's like to use the analogy of a family. If you have conversations with your kids about something that they want or something that they need, but you never respond, they tend to go to the other parent. They tend to try to build coalitions. There's this whole warfare that starts around it versus, we have communities, rural communities, who want a physician to live in the community and provide services to 20 people. We can't do it. It's just not possible. They don't want to live there. There's no getting it. So we can't make it happen. So that's hard conversations to have with community, but it builds that trust and dialogue. And it's about, I think a lot of times when people start conversations with community, or with employees who over the years the trust is eroded, they want one conversation to fix. Like, just trust me now, right? And people need to see it and to feel it and to know it and to have it be repeatable. And just to tie it to something I saw in the chat about homeostasis and the idea that we all go back. Some things that we get to homeostasis on for us are okay. Let's stay there for a little bit and we'll get to this other thing while this thing kind of levels out. So it's actually okay for a period of time to be in that steady state, but the steady state has to be defined by that collaboration, systems thinking. So just to put that out there as well.
Michelle, lovely. Thank you very much indeed. I hadn't drawn the sort of parallel in terms of where Shane was starting in terms of family into engagement, but I am after this going to be sending a survey to my 3 daughters to get some feedback on their parents of late, and I'll reply to them in 6 months. Michelle, thank you. Well, let's stick with this point about getting stuck in unhealthy patterns of behaviour. Jonty, really interested in your view, having gone to a new system, actually what that's enabling you to reflect on and learn in terms of where you've come from. Is there perspectives you can give in terms of how you support leaders to sort of take a fresh perspective and think about different ways of being?
Well, I think, I mean, I suppose my personal reflection is that I have, I mean, look, there were lots of reasons for making a change, but one of the unexpected opportunities that has arisen is it's undoubtedly enabled me to become more aware of who I am, how I am, and how I work within the system. I think, and this isn't in any way a sort of negative reflection, but undoubtedly over time, I think I was in Southeast London working in various different guises for about 28 years. I sort of became of the system, and I sort of filled a Jonty shaped space, and I'm not sure that I had the opportunity to really step back and reflect on who I wanted to be and how I could bring my whole self into some of the challenges that we were experiencing. So I think I've been using the opportunity to try to reflect and journal and think a little bit about sort of who I am in the context I'm working in now. And of course, the challenge of relationship is enormous, because so much of how you engender and enable change is through relationship. And so one of the things that I guess I have good days and bad days, but you know, on the days when I'm feeling a little disheartened, it's usually because I haven't yet established those relationships that I know are going to be so important, and giving myself the time, I think, to start to do that in a new system. So that for me sort of reflects some loss, but I think in terms of the sort of personal opportunity for development, it's been great to make a change. And I do wonder quite often, you know, Rich, you know, and I know Jonathan Gray's thought about this a little bit as well. I'm not sure that we really give people in leadership positions enough opportunity to move and to experience other systems or other you know, organizations or spaces or places. I feel inevitably, because of the pressures that people feel operationally, those sorts of opportunities that I had when I was first when I was first stepping into some of these roles, to visit even visit places within the UK, just aren't there anymore. So there's something for me about actually how incredibly stimulating and positive it can be to experience a different context. I don't know if that's helpful.
Jonty, thank you very much indeed. And if anyone is wanting experience of a different healthcare system, we're going to pop Jonty's address in the chat in just a second, so everyone can go and visit him in Singapore. Michelle, I wonder if we can come back to this point, which was picked up in the chat, and you talked about just in terms of the importance of safety. And actually having a system where you can admit, I lost count in the amount of times in your talk you just talked about vulnerability and admitting when we've got things wrong. When we have conversations here in the NHS, it can often feel like those sorts of conversations are happening despite the system, and that you have to work quite hard to carve out space for such vulnerability. Is that something you've grappled with? How much does your system support you to engender that environment of safety and wholeness, which sounds important to your approach?
Yeah, so it's not magic. It doesn't happen in a minute. So it's a system. So, but I will leave this conversation and drive down to work and be on the second day of a 3-day experiential learning experience we do with every employee in the organization, where it's based in Alaska Native culture, it's based in story, and then we use some tools from Ardris and Sangi to train all of our workforce in creating relationships. And it's a 3-day experience where people are put into a small group with people who, you'll have a physician and the maintenance worker and a front desk person and a behavioral health clinician. It's led by a peer, and they have on the third day they go off and they share a personal story with each other. So they create safety within 2.5 days in order to do that, and that then is translated into our work environments where all of our leaders are trained in this. We call it core concepts. Our CEO shares her personal story. I share my personal story. Other leaders, our physicians, share personal story in the front of the room to model and show the way. And then what we do after that is, because we're creating this vulnerability, this reducing of hierarchy, creating this safety, this is what it should look like when you work in your departments, is we evaluate that on our employee sat. Somebody asked, how do you know? Well, we know because we can evaluate it. Are the tools being used? Do you feel safe? Can you share your story? Do you feel supported? All of those are very, very important. They're not just fluff questions for us. It's really the questions, because, and then that's, we see it in our retention. Who are we keeping in our organization? Who stays with us? Because people don't tend to stay with us because we pay the most money. It's because they stay with us because they have a shared purpose and they get it and they feel supported in the organization. So that's a really quick way of saying we've created a system to support this, which we fight against and have fought against for years, because that old stuff comes up and people are like, what the heck are you guys doing? This isn't safe. It doesn't feel safe to me to do this. But over the years, we've been able to build a container so that we can bring people in and people feel safe in doing that.
Michelle, thank you so much for sharing. And I think a lot of people go, oh, why don't we do that? Let's do that. Come on, let's do that. Michelle, thank you. Time is against us, sadly, and we will be closing very shortly. And we'll come back to Michelle and Jonty in just a moment, just for a very quick closing bit of advice. But one final question in chat, and we will take all of this up. We'll find a way to play it back to you. So please do give us your view. But if there's a particular tip, insight, or observation which you've heard today, you'll be passing on to others, what would it be? So in the chat, please, see one. But we will come back first to Jonty and then to Michelle. Just 30 seconds, so that's okay. If you're going to give one bit of advice to others on their system leadership journey, what would it be? Jonty, then Michelle. Jonty.
So I think it would be the piece of advice that I was given before coming here, which was to start journaling, and it links to that conversation that we were having earlier around, or that I was sharing earlier about really thinking about the self-work, but doing it in a very kind of compassionate and reflective way. So journaling has become something that I'm finding incredibly helpful.
Jonty, thank you very much indeed. And Michelle, one piece of advice.
Oh, just one? Oh,
Sorry.
Can I put a couple of ands in there and get a couple in?
Sure.
I think it's asking yourself the question in all engagements and discussions, how am I impacting the people that I'm talking to right now? How am I? Not how are they? How am I impacting the people around me?
Michelle, thank you. Actually, we're not going to finish this now. We're going to extend it for at least 2 or 3 more hours, Michelle. We're just going to listen to you speak. Jonty, you can contribute if you like, but Michelle, we're going to thank you, Michelle. Thank you, Jonty. Huge thanks for joining at either end of your days. Thank you for everyone popping things in chat. Lovely to see. Next steps from us. We will close in just a moment. A reminder that this is what we get out of bed for at Kaleidoscope. If there's a way which we can help you, please do so. Please do get in touch. We'd love to have a coffee. We have a newsletter. We will have other events. There's also an evaluation form in chat. Importance of data is something which we've started to allude to, but please give us your feedback on this session. We do have a further session coming up in May, particularly on this theme of measurement and logic models, something which we do a lot of here at Kaleidoscope. But that is us pretty much out of time. So we do hope you've got value out of joining us today. Thank you again to Michelle. Thank you to Jonty. Thank you to Chian. Thank you to all for joining for today's session. We'll be sharing the slides and the videos, and we hope we see you again at a future Kaleidoscope event. Until then, thank you very much indeed, and have a good rest of your days, or whether it's just time to go to bed. Thanks for